Sir Lancelot and I are here to demonstrate to you what actually happens to your pet when they go in for a dental cleaning, or cohat as we call it. So I'm going to take you step by step through the process, and I already made a video about why you should get your cat's teeth cleaned, and you guys can find a link in the description below. But this is going to be all about what happens on the day. So there's several very important steps. It's all very methodical, stepwise. So the first step is going to be to assess that our patient is a good anesthetic candidate on the day. It's called a little health exam, first thing in the morning, cardiovascular exam. And then we're going to pre-medicate him, which means to give him a little shot of sedation. We're just going to make him super relaxed, and there's also painkillers in there, so he's really comfortable. And it's an essential part of preparing him for general anesthetic. And before we get going, please remember to hit like and subscribe. Pet that bell notification button, squish the subscribe button so you guys can be up to date on all these helpful and useful and very adorable videos. So, quick exam. Just having a look at the gums, make sure they're perfusing well. Gotta listen to his heart. Gotta catch him. Thank you, sir. And this is a fine demonstration of the differences between being a veterinarian and a human physician. Lancelot's getting all comfy, and of course you have to listen to both sides of the heart, both lungs, and everything sounds good. And I already did my pre-anesthetic blood work on him, so I know that he's physiologically a good candidate for anesthesia. So now we're just going to give him his pre-med. Mr. NJ, pre-med, please. Now, I do calculate pre-medicant drugs. I do design anesthetic custom for each patient. I did this one a little bit in advance just for ease of filming. Normally, I would do my pre-anesthetic exam and then go do some math, figure out the drug dosages, and just to make sure that it's exactly right for this patient on this day. Some people do use things like anesthetic pre-mixes, but I absolutely never do. I think they're a silly idea because every anesthetic should be designed for custom designed for the patient on the day. So pre-med, a little pokes, poke. And of course Lancelot's super chill. There you go. Good man. Yeah. That's it. I'm just going to give him a little while to chill in the kennel and relax. Lancelot looks like he's ready for surgery. He's just having a little train spotting moment. That is one calm cat. I think he's ready to go. So this first part is pretty much the same anytime you do an anesthetic. Doesn't matter if you're doing this for a dental cleaning or to remove a simple skin tag, or if you're going to remove a giant tumor off the liver. The first couple steps of pre-medication, induction are pretty much the same. Now you see here we're prepping Lancelot's arm for an IV catheter. Intravenous fluids are an essential part of any anesthetic procedure. It helps you maintain blood pressure within safe limits. It allows you venous access for drugs. You really cannot do anesthetics without IV fluid access. And I know that in some vet clinics, IV fluids are still shown on an estimate as an optional extra, but this is really a hangover from the bad old days, like 20 years ago when anesthesia in veterinary hospitals was absolutely medieval. You really can't be putting any patient under anesthetic without IV fluids. Mr. NJ, who is our lead technician, you can see him placing that catheter. He's an absolute master of the art. Placing an intravenous catheter in a cat is very challenging. He makes it look easy. Of course, having the patient properly sedated so that they're nice and calm, but not so that their blood pressure drops, making the veins collapse, is also a bit of an art. And after you get that catheter in, making it stay in place for a couple hours or maybe even a couple days, that is a whole different skill set. There it is, just beautiful.
And here the IV fluids are being connected. Look at that pretty boy. See, Lancelot's getting lots of love. And we are inducing. Now the injection being given into the IV line is called an induction agent. We use something called Alfaxan for cats in my practice. And this is a drug that's given IV, and within about 30 seconds it'll hit the brain and you will fall asleep, just out like a light. A little lick of the lips, you can see it's starting to work, and boom. See Mr. NJ supporting Lancelot's head right now. You can feel that head suddenly become heavy and drop into his hands. And Lancelot is out. See, no blink reflex. He's completely under anesthetic. Now the next step after inducing anesthesia is, of course, we need to have control of the airway. When a patient is under anesthetic, they don't have a swallow reflex, so if they throw up or if any water gets to the back of their throat, they can inhale it, and that could cause pneumonia or death. We achieve this by putting a tube into the trachea called an endotracheal tube. And this allows us to deliver oxygen as well as anesthetic gas to our patients. There's also usually a cuff that can be inflated to prevent any liquid from seeping down. And Mr. NJ once again makes it look easy. And here you see him hooking up the oxygen and anesthetic machine. And the cuff is inflated. Now patients will often get very cold under anesthetic, so we take a number of measures to try to keep them warm and cozy and maintain their central body temperature. We're wrapping Lancelot in a towel and putting little hot packs underneath him. And here you see us putting little booties on his feet. So these are little pediatric booties. They're really warm, and cats lose a lot of body heat through their paw pads. Putting little booties on their feet like this will actually limit heat loss under anesthesia, and I can confirm that this works really well and is also adorable. We'll often put little booties on all four paws for longer procedures. Now we're starting the scaling and polishing this procedure, and for a more detailed rundown of what we do and why, please check out my dental video that I published just a few weeks before this one. As you can see, NJ's working on all four surfaces of each tooth with that ultrasonic scaler and getting right down below the gum line. And this is just where I want to say once again that there's no way you can do this in a patient who's awake. That's why anesthetic-free dentistry is a scam. There's no way anyone can do this on a cat or a dog who's not under anesthesia. Look at that gingivitis. Here, we're gonna fix it. That should resolve a day or two after the cleaning. I love Lancelot's fangs. In the background, you can see my other technician, JJ. And yes, I know, NJ and JJ can be a little bit confusing, but just we have a lot of acronyms on this day. You can see JJ fiddling around with the blood pressure monitoring. Now, it is very important to have somebody monitoring the anesthetic while the surgeon or the dental technician is doing the dental cleaning. Here we are measuring Lancelot's blood pressure using this nice little machine. And there we go, completely normal values, as if he was still awake. Now you're supposed to have a dedicated monitoring person, but unfortunately many places you'll still see technicians doing dental cleanings and monitoring the anesthetic, and this is far from ideal. And here Mr. NJ is polishing the teeth. So after we're done scaling, getting the biofilm and the plaque off the tooth, we need to polish it to buff out all the microscopic scratches we put into the tooth, as well as to remove last vestiges of any adhering material. And again, no way you can ever do this without an anesthetic. Making sure those teeth are as clean as they can be, getting right down to the gum line. The importance of proper anesthetic monitoring cannot possibly be overstated. The reason I'm very comfortable doing complex anesthesia in very compromised patients is because I have a team that I can rely on. The gold standard is doing measurements every 5 minutes, which include full vitals as well as recording any monitoring equipment you have. By closely monitoring the patients, if we see their body is struggling with anesthetic, we can immediately make corrections or even wake them up without any permanent harm being done. As a doctor, I have a lot of tools in my toolbox to help a patient who's struggling with their anesthetic, but none of them will do any good unless we know what's happening. So monitoring is super, super important. Although ironically, one of the hardest parts of anesthesia is not messing with it when things are going well.
Typically, a dental cleaning like this takes about 30 to 45 minutes. You see Mr. NJ setting up a dental x-ray machine. And we're about to take some radiographs of Lancelot's teeth. They've been scaled, they've been polished. Mr. NJ has assessed the teeth, and now we can do some x-rays. And then the doctor, who happens to be me on this day, is going to review the radiographs and probe the teeth and make some decisions about whether any of those teeth need to be removed. X-raying cat or a dog's mouth is an incredibly challenging procedure. It takes a lot of real technical skill. And you can really appreciate how important it is to have the patient not moving under anesthetic and also have their airway protected and controlled. There's our first glimpse of Lancelot's jaw with a radiograph. Looking pretty good. You can see the little mouth model in the foreground to remind us of how many teeth our patients are meant to have, because of course it varies by species. And of course, radiographing every section of the mouth requires a slightly different position and slightly different technique. You can see Mr. NJ is adjusting the endotracheal tube when he moves the patient around to avoid having it kink inside of Lancelot's mouth and interfere with gas transfer. I think this really illustrates what a technical skill it is to do dental radiographs. Lovely jaw. I love looking at these x-rays, particularly as they're very healthy. And there me and NJ are kind of going over the radiographs, and he's telling me what he saw in the mouth while he was cleaning it so that I can use that information to interpret the rads.
Here's an example of a diseased tooth with a crown fractured and infected roots. I think it's important to say here, though, when we talk about extractions in veterinary patients, it would often be considered oral surgery in humans. So there's gum flaps, bone removal, and suturing involved. Although we do sometimes do simple extractions, we often end up doing something that's quite a bit more complicated than when a human needs a tooth pulled.
It takes a little while to flip through all the parts of the mouth and make sure that every single tooth is fine. A lot of information you get from these radiographs, and you can't really assess a mouth properly without radiographs. Now we're going to go off and do a little bit of probing. You got to correlate all that information you see from the x-ray with what we actually see in the mouth. So there we go, run a probe around every tooth, check the periodontal pockets, and this gives us all invaluable information. And together with the x-ray, we'll need to make a decision whether the tooth needs to come out or not. And we're done. Here we go. No extractions needed.
Mouth cleaned, everything healthy, and the guys have turned off the anesthetic gas and are about to wake Lancelot up. Now, recovery is a very important stage of the process, of course. We want all of our patients to recover. You see NJ's just suctioned out Lancelot's pharynx and making sure it's nice and dry. We're going to flip him over, because when you're on your back, you're not breathing with your maximum lung capacity. Putting a cat or dog in sternal really maximizes their lung ventilation, so that's how I like to recover them. And again, here's where your pre-medicant protocol plays a big role. I like my patients to jump up within just a few minutes of us ending anesthesia. Some protocols may result in a patient waking up over 3 or 4 hours, but I like my patients to be up and about within about 5 minutes or so after we turn off the gas. And here you see us deflating the cuff on that endotracheal tube that we inflated at the beginning of the procedure, so that we're ready to pull the tube as soon as Lancelot shows us that he can swallow. Still no palpebral reflex. Lancelot's still asleep, but he should be joining us any minute now. And I started looking for him to start picking up his head and maybe blinking a little bit, starting to look around. Gonna give him a little bit of love. I love making funny cat faces while they're under anesthetic. It's my secret confession for this video. Playing around with cats and dogs' faces while they're under anesthetic is one of my favorite parts of the job. Oh, there's a little swallow, and he's up. We trimmed just a bit, but this really took about 3 or 4 minutes. He's picking his head up, but he's still quite dopey. Does he have a swallow reflex? Does he? Oh, I think we saw him lick a little bit there. And come on, Lancelot. And I just gave the instruction, and Mr. NJ is pulling the T-tube, and our patient's fully recovered from anesthesia. Well, maybe not fully recovered. Often I get phone calls from owners, either the evening of a procedure or the next day, complaining that their pet looked quite bad, and they're worried that maybe they're having a bad reaction to the anesthetic, or that they're in pain because their dog is whining, or their cat looks all loopy and restless. And just really important to note that those are just normal side effects of anesthesia. The drugs take about 12 hours to leave the system, so your pet isn't going to be quite right when they get home. Here Mr. NJ is pulling the catheter. He's going to put a little bandage around the catheter site just for a little while, make sure it doesn't bruise. Lancelot has no idea what's going on. He's just seeing butterflies, wondering what happened. He's probably not even actually conscious yet. You can tell his pupils are all dilated, so chances are the light's on, but nobody's actually home. Of course, you could say that about a cat most days of the week. There's our boy going off to recovery. And notice how his fur is nice and dry because we draped him in. It can get quite messy otherwise. NJ has made a nice comfy recovery bed for him, lots of towels and blankets so he can be nice and warm and roll around in them, be all comfortable and safe. And Lancelot's tucked in. He won't stay that way for long because cats tend to thrash about quite a bit as they're waking up, but he's having a good time. And there's my team, NJ and JJ. Job well done, guys. And there I am. And that's a cat dental. Now, as I said, Lancelot's head's still going to be up in the clouds for quite a few hours. Squish that cat! Cats always try to take a dive out of the kennel when they're recovering from anesthesia. Lancelot is stumbling around like he had a few too many pints at the pub. The advice I give to all pet owners when they're worried about their pet looking funny that they have an anesthetic is just to set them up like a drunk friend. Somewhere warm and cozy where they can't fall down so they can sleep it off, and they'll be back to normal next morning. Lancelot's so confused. And he's probably hungry, but not interested in food yet. We're really hoping he'd eat for you guys, but he's too loopy to even be interested in food. Thank you for watching, and let's just enjoy a minute of Lancelot relaxing after his big day.